Good afternoon, everyone, and welcome to today's webinar of the Continence Foundation of Australia during this lovely World Continence Week 2020. Today's webinar is focused on the pelvic floor and why it is so important, especially as you age. Now, firstly, I would like to acknowledge and pay my respects to the traditional custodians of the land on which we hold this meeting today. And I would also like to pay my respects to elders past, present and emerging of all Australia's Indigenous peoples. Before we get started, just a few housekeeping details. If you're joining via Zoom at any time during this webinar, if you've got any questions, you'll be able to use the Q&A panel at the very bottom of your screen to ask any questions. We'll attempt to answer them as they come in. If you do have any very personal questions, we highly recommend that you ring our Continence helpline, the number which you can see later on the screen on 1800 66 0066. For people watching this on live stream on Facebook, your functions are a little bit limited. However, you can still submit your questions through Facebook. You will not be able to take part in the polls, unfortunately. And also for everyone to know that we will be recording this webinar. So if you missed this for whatever reason or would like to rewatch it, it will be available on demand on Zoom as well as Facebook for the rest of this week. And after that, we'll publish it on YouTube. So you will have the opportunity to see that again if you like to. Now, without further ado, I'd like to introduce you to our speaker today. Our speaker is Annabelle Citroen. Annabelle is a pelvic health physiotherapist, and she's got extensive experience in the assessment and treatment of both women and men's pelvic health issues. Annabelle completed her physiotherapy degree with honours at Melbourne Uni in 2007 and has gone on to complete postgraduate studies in pelvic floor physiotherapy as well as continence, musculoskeletal dysfunction, as well as exercise for women. She works as a physiotherapist at the Barwon Health Continence Clinic and the Central Melbourne Gastroenterology. And in addition, she's also a busy mum of 2 young children and enjoys spending time with them, being active outdoors. So please enjoy Annabelle's presentation.
Pelvic floor muscles are an important group of muscles located at the base of our core. They sit within the bony pelvis, the word pelvis itself meaning bowl. These pelvic floor muscles fill the base of this bowl and extend like a hammock from the pubic bone at the front, underneath to the tailbone at the back, and stretching to either side, attaching to our sit bones. These pelvic floor muscles play an important role in many functions, including support of the bladder and bowel, and in females, the uterus. They help control the bladder and the bowel, assisting us to hold on when we need to, allowing us to let go when it's convenient. They also play an important role in sexual function. There are a number of factors over the course of one's life that might either cause or impose a risk in terms of weakening or causing dysfunction in these pelvic floor muscles. These include pregnancy, going through or having been through menopause, gynecology surgery, for example a hysterectomy, surgery involving the prostate, and for athletes who may have undergone high impact exercise, including gymnastics or trampolining. Other risk factors may include a history of back pain, trauma to the pelvis, whether that be through a fall or radiation therapy, constipation, meaning frequent straining to empty the bowel, being overweight, and heavy lifting, either through your job or perhaps in a gym environment. It is also important to keep these pelvic floor muscles functioning well across the course of your entire life. These pelvic floor muscles are so important in maintaining bladder and bowel control, and therefore allowing you to continue exercising without fear of leakage, let you keep socialising and getting out and about without worrying where the next toilet is, and keeping you independent and home for as long as possible. Barely a day goes by in my day-to-day clinical practice where I'm not asked by a patient, a question along the lines of, am I too old for this? Isn't it too late for me to make these muscles stronger? The answer to this question is no. You're never too old to invest in strengthening and improving the function of these pelvic floor muscles. By now, I'm hoping I've got you all on board and convinced that it's worth spending a little bit of your time every day investing in practicing these pelvic floor muscle exercises. As we've just discussed, they help with both bladder and bowel support, uterine support for the females. They help to control bladder and bowel and are an important component of your sexual function. When we discuss doing these pelvic floor muscle exercises, there are a few considerations. Firstly, correct technique. Secondly, some signs that you may not be doing the correct exercise and therefore potentially doing more harm than good. And thirdly, how many of these exercises you should be trying to practice in order to see some results. When it comes to correct technique, we discussed earlier the location of these muscles within your pelvis. If we look back at our model again, we know that these muscles encapsulate the bladder tube, also known as the urethra, the vaginal opening in women, and the back passage, or the opening from the bowel. When we try to engage these muscles with correct technique, it's important that we're considering where these muscles are and what we're trying to achieve with them. So we can think about or imagine trying to stop the flow of urine. We could also alternatively think about holding onto some wind. So I'd encourage you now, sitting or standing wherever you may be, to think about where these passageways fall and to try and squeeze and tighten around these passageways as though you're holding onto urine or trying to stop wind. Now you may also feel, when you're squeezing these muscles, a small lift inside. We know that these muscles also lift and support the bladder and the bowel and the uterus in the female. And so you may feel a small lifting motion up and away from your underwear or perhaps the chair that you're sitting on. So let's try together, and I want you to try and squeeze and imagine holding the wind, stopping the flow in urine, squeezing up, lifting up and holding. Let's try for 1, 2 and 3. Now release and let that go. And it's important that with every squeeze and lift that we also feel a release and a let go, and that we have some time in between before we start to squeeze the muscle for the next contraction. I'll talk a little more in a moment about how many repetitions and how many times a day, but I would also like to bring to your attention some of the signs that might indicate that you're not perhaps using the right muscles or isolating the pelvic floor muscles in the best possible way. We know, as I said, that these muscles are very much isolated around those openings to the bladder, the bowel, and the vaginal opening also. So if we're seeing signs from the outside that you're trying to exercise these muscles, it may well be an indication that you're doing the incorrect technique or using muscles that you need not be wasting energy and time on. So for example, if we should see you moving up and down in the chair, squeezing your buttock muscles, if we should see the tummy muscles pulling in and out, or breath holding, or even the legs squeezing together, they are all signs that we're using muscles other than these pelvic floor muscles. So it should be from the outside almost invisible, an activation internally that you can feel, but no one else can see. Now coming back to the question as to how many contractions should I be doing, how long should I be holding each contraction for, and how many times a day should I be doing these exercises. There is no one-size-fits-all approach. However, we can give some general guidance beyond which, if you have any concerns about your technique or whether your program may need to be individualised for you, I'd highly encourage you talking to your GP or seeking a pelvic health physiotherapist in your area to assess and individualise a program for you. To start with, we can consider doing just a short contraction, becoming aware of where these muscles are and ensuring we're spending some time between each contraction, releasing and letting go. So an example may well be that you start holding for a count of 3 seconds and resting for at least 6. The goal overall is to achieve some fatigue or some tiredness in those muscles and we usually aim for around about 10 repetitions to achieve this. Let's practice a few together now. You can perform these exercises in any position. Most people will find it easier to perform either lying down or sitting to begin with, and then progressing to more upright positions like standing as you get better at the exercises. We also know that if you're having a particular problem when it comes to bladder or bowel control, that we can learn to use these muscles as part of a task. For example, a common problem is leaking with coughing, sneezing, laughing. So if you can feel a cough or a sneeze coming on, it is worth starting to try and practice contracting these muscles just ahead of the cough or the sneeze in order to close off the pipe to that bladder and prevent the leakage associated with that cough. Let's go back to practicing a set together now. And I want you, as I said, to find a comfortable position, one in which you feel that you are most aware of what's happening in these pelvic floor muscles. And we're going to practice to start with for a count of 3, holding on and then resting for 6. Let's start together. I'll use my hands as an additional cue, remembering from the outside it should be invisible. So we're going to squeeze and lift inside like we're stopping the flow of urine or stopping wind, holding for 1, 2 and 3, and releasing for 1, 2, 3, 4, 5 and 6. And again, squeeze and lift. Hold for 1, 2, 3 and rest for 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Squeeze and lift. 1, 2, 3 and rest. 1, 2, 3, 4, 5, 6. Last one, squeeze and lift. 1, 2, 3 and rest. So there you go, you've all attempted a contraction and a set of pelvic floor exercises. That's one round, and if we're really trying to work this muscle hard and see gains, we're trying to aim to do around 3 of those sets per day. It's a really good idea to try and attach it to something that you do on a regular basis to enable you to remember to do the exercises. That might be, for example, whilst waiting for the kettle to boil for your morning cup of tea. It might be whilst you're sitting at lunch table having just finished your lunch, or perhaps in an ad break when you're watching your favourite evening show. I hope you're now feeling much more informed about what these pelvic floor muscles are, where they are, how they work, and that I've convinced you it's worth taking a little time out of every day to invest in making them stronger and functioning well to ensure good bladder and bowel health, sexual function for many years ahead. If you do have any concerns regarding your current bladder or bowel function, I'd highly suggest that you go and speak to your local healthcare provider or ring the CFA National hotline to seek help to have an individualised assessment and management plan for your condition. And that's all for me. Thanks for tuning in and learning all about the pelvic floor muscles, where they are, how they work, and I wish you all the best investing in a very important part of your body for many years to come.
Thank you, Annabelle, for that wonderful presentation. I hope you all very much enjoyed Annabelle's presentation and her points, and I just wanted to reiterate a few points. But firstly, you'll notice that we just launched the second poll for you. And the first poll hope you saw the results was actually quite interesting. So looking at our participants here, most of you, 91%, knew what the pelvic floor is, which is absolutely fantastic. And most of you train it sometimes or regularly, which is really good as well. Now that actually reflects what we know about the public in general, that most people actually know where the pelvic floor is or what it is, but don't do it regularly. So I would really encourage you, as Annabelle mentioned earlier, train your pelvic floor regularly and link it to something that you can remember, like waiting for your kettle to boil and so on. So that's really important. And it's never too late to get started. That's another very important point. You can get started at any time. You're never too old. It's never too late. Really important to know that. Looking at the first poll as well, we saw that looking 70% of you, of all the people in the audience actually do experience some leaking when they cough, sneeze, laugh, or exercise, and that is what we classify as incontinence. So for all of you that said yes there, even more important to make sure that you regularly train your pelvic floor. That can really help you with that. We just had the second poll come in, and looks like most of you have learned quite a bit, which is excellent. And again, 80% said, yeah, definitely I will try to start doing my pelvic floor muscle exercises now, which is excellent. That's exactly what we want to hear. Now, I'll just quickly share my screen with you because I wanted to point your attention to some more resources that we have. There we go. I hope you can see that now. So some of the resources we provide for all of you for free, both in print and PDF format, are the ones that you see just on the screen now. So we've got leaflets on pelvic floor muscle training for women as well as for men. We have some specific resources for people of Aboriginal and Torres Strait Islander backgrounds also. And we have some easy English resources. So for all of you that might want to look at something that's a bit more pictorial, or you clients, if you've got clients, those easy English resources are very popular and they're really good. So have a look at those. You can download them on our website at continence.org.au if you head to the resources section, or you can go to pelvicfloorfirst.org.au, which is our pelvic floor specific website. And again, there under the resources section, you'll be able to download them for yourself. Now, I just wanted to point out that for any of you that need some very personal advice or have some further questions that you'd like to discuss with someone, please ring our National Continence Helpline. That is a free service, it's confidential, and we have continence nurses that are very experienced on the other side of the line. So 1-800-33-0066, and they'll be able to help you or refer you to an appropriate health professional.